Hello, darling. How are you today?
Inside this care home, they often know the answer to that question. Many of their residents have confirmed Covid-19. Sent here from hospital, not by accident. It is all part of the plan. So where are the isolated patients?
We have an isolated floor, so it's the whole floor. It's the second floor on the building.
The carers filmed their painstaking precautions for us. Full PPE, constant cleaning. But here, they actively accept Covid-positive patients.
I was frightened that some of our lovely residents that live here might possibly get the virus. But then you've got to gather yourself up and I've got to go in there and fight the battle.
Here's an empty room that we have.
It is partly a financial fight. Empty beds mean they need the money. The NHS block booked 15 at the start of the pandemic. Why would you want to take the risk of bringing a Covid-positive patient into a home like this?
I have had some sleepless nights over this. It's not an easy decision to make. If I don't take people in, the business at risk, but I wanted to play our part in helping those people out in the community or out in hospital who could come in and recover with us.
And this home is not alone. ITV News has learnt that 1,800 care home beds were block booked by the NHS and councils to take patients from hospital. That's just across the 17 regions of England which provided us with data, including 182 beds in Suffolk, 122 in Wirral and 86 in Oxfordshire.
Blow me a kiss. Bow.
At this home near Nottingham, families just about manage to say hello, but worry more about waving goodbye.
I can see the point of the hospitals. They want to empty the beds, but why do they want to put them here? And there's just a danger of infecting everybody else.
They've taken 20 patients with Covid-19 here, but are now beginning to refuse them.
The biggest frustration is feeling that we're being used as a Covid cleansing house. It's put unnecessary strain on our staff and we've decided we're not doing that anymore.
Until now, the government's denied there was ever any push to do it in the first place. We've got the evidence that beds were block booked in care homes. There was pressure, wasn't there, to discharge patients from hospital into care homes?
The number of people leaving hospital to go into care homes has been reducing, not rising, through this epidemic.
But these beds were block booked at the outset, so there was pressure at the outset to discharge, wasn't there?
Well, I don't, you know, the critical thing is what actually happened, and what happened was that there was a reduction.
But despite the care that's taken, some believe discharged patients did spread the virus, and moving them into homes may have helped empty them. Paul Brand, News at 10.